When trying to conceive, an indicative sign is a slight bleeding that indicates a new life is growing inside the womb and can be mistaken for the beginning of a period. This is called implantation bleeding. In this AllForBabies video, we explain how to differentiate implantation bleeding from a period. What is implantation bleeding? It's one of the first symptoms that can indicate pregnancy. The characteristics that help identify it are as follows. First, it's a pink, brown, or brownish bleeding, very similar to what occurs on the first day of menstruation. This bleeding is very light and doesn't require the use of pads, menstrual cups, tampons, or menstrual panties, as it's just a few drops that appear on underwear or when wiping with toilet paper. Additionally, the discharge isn't continuous. It occurs only once or intermittently. As for its duration, it usually doesn't exceed 48 hours. It's also easy to identify. In women with regular cycles, it appears a few days before menstruation should start. On the other hand, those with, for example, 18-day cycles might experience implantation bleeding between day 21 and 24 of the cycle. It's worth noting that there are many causes for which women might experience light vaginal bleeding: hormonal causes, issues with the female reproductive system, use of certain medications, changes in lifestyle habits, among others. Therefore, any alteration in the menstrual cycle that catches your attention should be discussed with a doctor. We understand that seeing blood stains on underwear while trying to conceive can be frustrating. For this reason, let's look at the differences between implantation bleeding and a period. 1. Duration. Implantation bleeding lasts between 24 and 48 hours, while a period usually lasts an average of 4 to 7 days. 2. Frequency. Implantation bleeding occurs intermittently within that time frame. It's not continuous. A period is continuous from start to finish. 3. Amount of expelled blood. Implantation bleeding appears as just a few drops that don't soak through underwear. In contrast, more blood is expelled during a period. 4. Presence of clots. Menstruation is accompanied by blood clots. Implantation bleeding never contains clots. 5. Color of bleeding. Implantation bleeding is usually brown or copper-colored, whereas menstrual bleeding is intense red that changes throughout the days. 6. Timing of appearance. Implantation bleeding occurs a few days before the expected date of menstruation. 7. Influence of sexual intercourse. For implantation bleeding to occur, unprotected sexual intercourse must have taken place. 8. Symptoms. Implantation bleeding can be accompanied by some pregnancy symptoms like abdominal cramps, breast tenderness, or nausea, confirming if it's implantation bleeding. Not all women experience it, nor does it occur in all pregnancies, but confirming whether it's that or menstruation is quite simple. On one hand, you can take a home pregnancy test with a kit bought at a pharmacy. On the other hand, you can have a blood test done at a medical center to check the level of human chorionic gonadotropin hormone. This hormone is produced in large amounts and doubles day by day when the fertilized egg implants in the uterus. Both tests should be done after the expected date of menstruation, so that the hormone concentration is high enough to be detected by the tests. Tell us, do you think you're pregnant? See you in the next AllForBabies video.